All right, we're continuing on with the pectoral girdle, and we're going to move on to the arm bones. Start taking a look at those. Let's zoom in here. The upper arm bones are, each one is called the humerus. So that's the main bone of your brachial regions on each side. And we're just going to take a closer look over here at the right humerus so we can see the features. All right, so the humerus, let's talk about its articulations. So it is forming a proximal joint with the scapula up here where those two bones come together, and you have that glenoid cavity that forms the ball and socket type joint between the humerus and the scapula. That's kind of an important joint. It's also one at which people tend to have lots of problems. It's fairly easy to have that one get injured. And then down here at the distal end, at the elbow, you have your elbow joint, and that is a joint between the humerus and one of your forearm bones called the ulna, and the other forearm bone is called the radius. So we'll rotate that around so you can see those as well. All right, let's deselect those. And let's take a look at your features on the humerus. Let me get rid, I'm going to strip off these ligaments so we can see the proximal portion of the humerus here. Features you need to know. All right, so the head is not too difficult. The head is just this round, ball-shaped feature there on the proximal section of the humerus, so that's pretty easy. All right, and then here at the proximal end, you've got a couple of bumps that are called tubercles. So you had a tubercle on your ribs as well. Tubercle is another name for bump. And so you've got a big bump on the humerus. If I kind of rotate the humerus around this way, you've got a big bump right over in here, and that is the greater tubercle. So right in there, that's your greater tubercle. Tubercle means bump. And then over here, you've got a smaller bump, and that is called the lesser tubercle over in there. And then you've actually got like a little groove or a depression between the two. All right, and the reason you've got those bumps there, those are attachment points for muscles that pull on them. And so because of that, the bones tend to thicken in that location and form those little bumps. All right, so there's another view, greater tubercle, lesser tubercle. And those are all the features that you need to know down at the proximal end. As we scan down here, you're just looking at the shaft of the humerus. And we're going to come on down to this end over here. And we're taking a look at our elbow joint. And let me actually get rid of the ligaments that we have here, helping to hold these three bones into place that you have at the elbow joint. So this is a pretty good little view that we've got here. Let's see. Let's zoom in and move this over. All right, so next on your list, you've got your medial and your lateral epicondyles. All right, so do you see how here at the distal end of the humerus on each side, the bone kind of flares out? And if you could feel that between your thumb and your index finger, it would feel kind of flat. You'd almost feel like little wings that are sticking out over there. Those are your medial and your lateral over here epicondyles. You got a lateral epicondyle over there. Those are also attachment points for muscles. Epi means over something, and the feature that you see just distal to there, right in here, you've got a rocker-shaped feature, so technically that is a type of condyle because of that. The rocker shape is what allows you to make this hinge motion at your elbow joint. So that is technically a condyle. It has its own little special name, though, the features here. Let me kind of rotate this around. I'm going to say goodbye to that. kind of rotate this around. All right, this kind of hourglass feature that you have right in there is called the trochlea, and it is part of the humerus. And then next to it, there's a ball-shaped feature. Next to it, kind of looks like a bald head, and that is called the capitulum, is the name for that. And cap can refer to head, so that's where that name apparently came from. It looks like a little bald head there. All right, if we look a little bit more closely at this elbow joint that we have here, and we're on the antecubital, we're looking at the antecubital region, the anterior side of the elbow joint. You see how you've got, all right, this is the ulna here. And there on the ulna, if you look closely, you've got a pointy projection right in there. That's actually called the coronoid process of the ulna. Remember, you had a coronoid process on the mandible as well, and it had kind of a triangular shape to it. So I kind of rotate that around. When you flex your elbow joint like this, that coronoid process rotates around the trochlea. The trochlea has this hourglass shape that you see right in there. So that little pointy process, the coronoid process, rotates around and into this indentation that you have on the humerus, on the anterior side that you see right there. And so that is actually called the coronoid fossa on the humerus, right there. Okay, and then now over here, the capitulum, which is lateral, the trochlea, the hourglass-shaped feature on the humerus is medial. The capitulum is lateral. And remember, you got to remember, think about these bones being in anatomical position when we're talking medial and lateral and left and right and so forth. All right, this bone is called the radius. And if we kind of rotate it around, you can see it has a round-shaped head. This is the head of the radius. And the head of the radius, which really does look very circular, contacts the capitulum. That's where those two bones form their articulation. Now around here over on the back side, if we rotate this around, all right, this is the ulna. And you see how the ulna has that claw-type shape? And the ulna has this big feature that you see here that looks like a claw sticking up like that. That is called the olecranon process of the ulna. All right, and so when your elbow joint is fully extended like this, that olecranon process of the ulna rotates like a hinge back into a depression on the posterior side of the humerus. So let me hide those two forearm bones for a minute. This big depression, and this is on the posterior side of the humerus, is called the olecranon fossa. So on the posterior side of the humerus, you have that. On the anterior side, you have the coronoid fossa, and that is the depression around which the coronoid process of the ulna rotates into when you flex your elbow joint. So quite a few little features there associated with this, with the elbow joint. Okay, now I've got everybody brought back up here. Let's take a look. Let's see what a humerus by itself would look like. So I'm going to highlight it, and I'm going to hide everything else on the skeleton. And I'm going to deselect it so it looks like a bone. All right, so here is a humerus by itself. Could you recognize, if you just saw that bone by itself, would you be able to recognize the proximal end versus the distal? Hopefully so, because the proximal end has that ball-type shape. Of course, that is the head of the humerus. You've got your greater and lesser tubercles. And then down here at the distal end, can you recognize the anterior side versus the posterior? They're pretty distinct. The anterior side, you have the coronoid fossa, and it's pretty small. If you rotate it around to the back side, you've got that huge depression, the olecranon fossa there on the posterior side. And then the trochlea is medial, the capitulum over there is lateral. And so that can actually help you. If you just saw a humerus sitting by itself, you should be able to figure out, just looking at it, whether it's a left or a right humerus. Okay? The reason for that is because the ball of the humerus is always going to face medial. All right, and then you know that this is the anterior side of the humerus, so the trochlea will be medial and the capitulum will be lateral. So if you saw this bone just sitting by itself, based on how those features are positioned, you would know that this was a right humerus and not one from the left-hand side, because that ball is going to be facing toward the scapula to form that right shoulder joint there. Okay, so we actually already talked about some of them to bring everybody back. All right, we're back. Now we already talked about some of the features of the forearm bones, the ulna and the radius, but now we're going to take a closer look at those two bones and the additional features that you need to know. All right, so in the forearm, and we have to think about being in anatomical position, so remember your anatomical position. When you're standing in anatomical position, the medial of your two forearm bones is the ulna, and the lateral one is called the radius. Now, your forearm is capable of a rotational movement, so if you imagine these two bones rotating around each other, such that your thumb is now medial rather than lateral, at that point you're not in anatomical position once you do that, but when those bones rotate around each other, things are flipped, and now the radius winds up being medial over here and the ulna is more lateral. But in anatomical position, the ulna is your medial bone, the radius is your lateral bone. All right, and we're going to zoom in. Let me get rid of these mini ligaments we have around our joints here so that we can expose the bones better. I mean, you even have a sheet of dense connective tissue there that helps hold the ulna and the radius together. All right, so features of the ulna. Take a little bit closer look at it. See, there are lots of connective tissues down there that we want to get rid of so that we can see a little bit better. All right, so the ulna, which we took a look at fairly extensively earlier, but here it is again. All right, so again, it has this coronoid process, and that's going to rotate around the trochlea, that little groove there, and the coronoid process, that little pointy projection there, that you can see, rotates into the coronoid fossa on the humerus. And then around here on the back side, you have the olecranon process, this larger claw-shaped feature that rotates into the olecranon fossa on the posterior side of the humerus. Get rid of those guys as well. All right, and then another feature of the ulna, I'm going to highlight the humerus and I'm going to make it go away. And do you see how on the ulna right here, you have a notch or a C-shaped surface there that's formed between the olecranon process and the coronoid process over here, and that is called the trochlear notch. So that's what's rotating around the trochlea when you flex your elbow joint. All right, then down at the distal end of the ulna, all right, believe it or not, interestingly, this portion of the ulna down here at the wrist, where it's articulating with the wrist bones, that's actually called the head of the ulna, even though it almost seems like the other end has more going on at the elbow joint. And notice how on the ulna, this little portion of it hangs down on the medial side, and that's called the styloid. That is called the styloid process. Remember the styloid process in the skull and the temporal bone kind of look like a fang, and you have a styloid process, not quite as fang-like, or not quite as sharp and pointy there on the medial side. So on the medial side, when you're feeling that bump over there, you're feeling the wrist bones and also the styloid process of your ulna at that location. All right, so if you see an ulna by itself, let's hide everybody else. If you had an ulna by itself, it's pretty easy to recognize if you rotate it around, because only the ulna has that claw-like shape up at the elbow joint. So that makes it pretty recognizable. Not too hard to tell what you're looking at. All right, and then the radius over here. Let me see, rotate around. I was actually started on the back side of the skeleton. Here's your radius. Let me get rid of my ligaments again so we can see the radius better. All right, there's the radius, and the radius has a very round head. I mean, the head, this is actually called the head of the radius. So the head of the radius is actually at the elbow joint. It's on the proximal portion in contrast to the ulna. And it really does look like a circle. We'll see that when I highlight the radius separated from all the other bones. Then there's a bump on the radius right here. That is called the radial tuberosity. So, sometimes bumps are called tubercles. In this case, it's called a tuberosity, which is kind of a cool word to say when you think about it. And that little bump is there because that's actually your biceps brachii muscle up here in the upper arm is connected to, it pulls on that bump on the radius, and that's what allows you to flex your elbow joint. And so you develop that bump there because the biceps brachii muscle, which we just typically call the biceps in casual lingo, pulls on that part of the bone and creates that bump. All right, and then down, in contrast to the ulna is wider proximal and narrower distal. The radius is actually wider at the distal end. And it actually has its own little styloid process over there, but you don't have to know that for the radius. The one on the ulna right over there is more prominent. And let me hide everybody else. Let's see, we're going to get rid of these connective tissues so we can see just the radius. Go away. All right, I just want to bring up, the radius is very recognizable because this is what it looks like when it's sitting by itself. It has a very round circular head. Very easy to see. And then there's the bump right in there. That's the radial tuberosity. You can see it from some different views as well. All right, so I'm actually going to stop this particular video clip there, and then we're going to move on to the bones of the wrist and the hands, and that will finish out our pectoral girdles appendages, and then we're going to be ready to move on to the pelvis and the appendages, down your leg appendages.